Hello, Thrive Nation. We've got a special doctor who's going to be talking about women's health. And she's in the USA. She's a board certified plastic surgeon. She's involved in just inspiring and empowering women of all ages. I just love her social upliftment organizations that she supports. I was intrigued by her bio because I don't know, from her website, she just felt that she really cares. And so we've got an incredible, unique doctor in Dr. Alexis Parcells on the podcast today. So welcome to the show.
Thanks so much for having me.
Good. Let's talk about women's health and let's talk about Girls Inc. first to start with, and Breasties. I'm just overwhelmed by your heart to volunteer, and I think you've got 2 daughters. And just tell us a little bit more about that and why you're so interested in sort of inspiring and empowering women.
Yeah, it's a great question. So I initially got interested in plastic surgery from volunteering. When I was in high school, I was a member of our local chapter of Operation Smile, which is an organization that helps to repair cleft lips and cleft palates. And so starting in high school, I started going on medical missions with the organization. I went to Morocco, Kenya, Vietnam, Peru, so just a few countries. And that inspired me to pursue a career in plastic surgery. And it wasn't really until I was in the midst of my training that I realized, gosh, it's going to be really hard for me to actually become a cleft lip surgeon because I have to join a hospital system. And the best care for these patients is a multidisciplinary approach. And I knew I really wanted more of a community medicine type of practice to be able to treat my hairdresser, my dry cleaner, the people I know next door. Just that community approach was really important. So I ended up shifting my focus more towards breast reconstruction patients. And that's when I really got involved in organizations like Minette's Angels and the Breasties, which are all about empowering women. I mean, 1 in 8 women is diagnosed with breast cancer, and reconstruction is a huge part of that journey for these women. So that was sort of my impetus for getting involved in those organizations. And then at the same time, I became a mother during my training. And so organizations like Girls Inc., which help to empower young girls, just seemed to fit really well with what I was trying to do with my practice. So that's how I got involved in all of those organizations. And it's been really rewarding getting to speak with young women and empower them and advocate for them, whether it's through breast cancer or just in underserved communities.
Great. I mean, they've got a brilliant meme, be strong, be smart, be bold at Girls Inc. And it seems that I think you sort of just empowering for people that really are struggling with their health, possibly that have gone through breast cancer. What is the state of women's health? It seems like there's obviously, across the board, the CDC, even before COVID, said that longevity has gone sort of backwards the last 3 years. What's happening to women's health in the US and abroad?
It's a good question. I think access has become a problem, especially as we're seeing in the United States. Women are, different political situations are limiting women's access to care. And then in terms of everything with COVID, I mean, that shut down a lot of essential services for everyone, women included. And so, we were seeing here with the COVID surge that women were not getting prompt care. They were afraid to come into hospitals. They were afraid to come into doctors' offices. And so now we have a backlog of, women needing their mammograms and women, feeling safe in physicians and physician offices and medical clinics. And so we have a lot of work to do to encourage women to come in and take care of themselves, because, there is that fear of, it's sort of in the back of their minds from everything that's happened over the past few years.
Brilliant. Now you got 2 daughters. I've got a beautiful daughter. She's just about to turn 6 this month. And we've got an older son, and raising a daughter has been quite unique and different. But in terms of their health, obviously, different hormones, different stages of development. If you look at your own 2 daughters, I don't know how old they are. A lot of mothers listen to the show in Africa and worldwide. Tell us your basic health strategy, especially for women growing up, as young adolescents to teenagers, because there seems to be so many things against these young women in terms of maintaining sort of their healthy bodies, minds, and spirits.
And it's interesting you say that, because as a plastic surgeon, I see the women that come in who are really frustrated with where they are in terms of their bodies and their health. And I think a lot of it has to do, especially in the United States, but abroad, is in the types of foods that are being presented to children and adolescents. I always comment to my family and friends, I didn't grow up with snacking, but this whole idea, at least here, is my kids want to eat snacks 6 times a day. They don't want to sit down and have a proper meal. And snacks are processed foods. And so it's really hard to convince your child to eat carrots. I have 4 and 6-year-old daughters, to eat carrots, to eat apples, to have peanut butter when they want to have goldfish or pretzels or all of these other processed foods. And I think over time that absolutely is, it relates to their cognition, it relates to their ability to focus, it relates to their wanting to be outside at a park exercising, their energy levels. So in our family, we prioritize health education. So with my children, I like to teach them, this is what a protein is, this is what a vegetable is, this is a fruit, this is a grain. And so you get to pick what you want to put on your plate, but we have to have a balanced meal. I often set fruit out for dessert, which has become really popular in our house. So they feel like they're getting a little bit of sweetness after a meal without going right for the sugar, the cookie, the cupcake, whatever it is. And I also think just not bringing the food into the house is really important. So I think these dietary choices absolutely affect our children's ability to sleep, to function during the day, to want to get out and exercise. And so I think that's one piece of it. And then the other piece is the digital revolution and how much time our children are spending on screens. And so we try to limit that as much as possible with them, a show on the weekend or, maybe a special program, but otherwise I want them playing with each other, doing puzzles, doing more cognitive function-based tasks at home, as opposed to, being on a screen. And listen, I understand as a working mom, sometimes you just need to throw a screen on so you can have that meeting or, or get some work done, or just have peace and quiet for your mental health. So it's a challenge. It's definitely a challenge. Every day is a challenge, but I think preparing for the day in advance helps to ease that struggle.
What about, can you speak into xenoestrogens? It seems to be affecting women's, gynecological development, all these estrogens, these xenoestrogens in our water, in our air, in our food. And I do want to focus on women's health. I do want to get to the plastic surgery side. I do want to talk about skin health, but I think it's important that people are listening. We need to try and prevent disease before disease is there. I want to talk about breast cancer and that, but what can we do about all these xenoestrogens and what is happening to the hormonal balance of our young daughters and adolescents and teenagers?
So it's a really loaded topic, and there are a lot of lobbyists in our country who don't want that information necessarily out, or the studies are not as compelling as I think they could be. But again, the whole idea is that a lot of our foods could be from, if they are from animals, the animals may have received estrogens, and there are also products on the market that are what we call endocrine disruptors. And so what that means is that they confuse your body. Different chemicals are confusing your body into producing hormones when that's not necessarily an ideal situation. So what I recommend, and again, this can get expensive because a lot of people can't afford this, but those fruits and vegetables, you have to make sure you wash them. You have to make sure that if they're near a field or plant that could be potentially contaminated, you want to wash all those chemicals off before you eat those fruits and vegetables. Same thing for fish, meat, all of that. Really spend some time cleaning your food to try and get off any potential chemicals. If you can afford the non-GMO route or the organic route, again, that's really going to help, because those types of products are supposed to be treated in a way that limits the amount of preservatives and chemicals that are added into that process. And then additionally, the daily products that you use, such as your body washes and your personal care products, as well as your home care products, I recommend going a paraben or sulfate-free route, because again, these products have been shown to be endocrine disruptors. Anything from the deodorant that you're using to your makeup and skincare, you want to look at those bottles. Every time you're making a purchase, you're supporting someone, right? So you want to make sure that you do a little bit of education and get on if you can afford those brands, and there are thankfully a lot more that are on the market now than let's say 5 or 10 years ago, which can really help both yourself, your family, and our environment, choosing bottles that can compost or decompose, choosing products that don't have these, don't have these hormones, or advertise that they're cruelty-free, advertise that they are vegan products. These types of decisions really make a significant impact, because if that's where the money's going, if these products are being supported, then the other industries, the other people, competitors who don't necessarily have these products are incentivized to create a line that supports the environment, that supports cruelty-free and vegan and organic. So choose wisely is what I say.
Well said, Dr. Alexis. I want to press you a little bit, because people of, there's a long piece of string out there and people don't know where to put time and energy. Obviously, ensuring that you've got good glucose levels and insulin levels are crucially important. If someone's going to have a cookie or a donut, having
Right.
a non-organic, apple is far better, or non-organic, vegetable is so much better. But if 10 is so important, like the most important, where does it sit in terms of organic fruits and vegetables compared to sort of your traditional? I mean, should people be saving significantly in terms of their health, especially their gynecological health, which you're involved in? There's 1 out of 8, women getting breast cancer. I mean, these are huge numbers. Should they be spending significant time and money? And what, on the scale, where would you put that at?
So you can do, again, this varies based in region, but you can do quick online online searches based on where you live and what produce is in season, to understand what are the dirty fruits and the dirty vegetable versus, the clean ones. And so a basic or good rule of thumb is, if you can peel it, that means that the fruit has a barrier. And so it's not going, the chemicals are not necessarily going to penetrate as deeply as something that you would automatically bite into. So for example, a banana or an orange, if you have a certain budget, those fruits, or an avocado, those fruits may not necessarily need to be organic to still reap the benefits, but something like a berry or a peach or an apple, you're going to bite right into that skin. So I would say, prioritize those fruits and vegetables that you're directly going to be biting into, to have those, or to have an organic background if you have to make those decisions, versus something that's peelable.
Sure, that's really well said. I think I've never thought of it like that, but it just makes a lot of sense there. And in terms of these organic products that the ladies put on them, in the armpits, with
Yes.
breast cancers, how important is that?
Again, the research there is murky, but I always say you want to go aluminum free. You want to go in terms as natural as you can be with the deodorant. What's interesting is that your body takes a few months to accommodate to a new deodorant. So oftentimes women may try it and say, it doesn't work for me. And so for those women, I say you really have to give it 6 weeks to 2 months. So keep it in your car, see if you can get a sample of it to keep in your bag. If you feel like you may need to apply it a few times more than you usually would the routine deodorant you were using, but really try and stick with it. And there are different brands, so sometimes you just need to alter a little bit, but your body will react to it eventually. So it may be an uncomfortable, month or two, but it's well worth it just to have that, that clean product on your body.
Brilliant. Okay, so you're the founder of a skincare product line. I think it's called Sunny. Tell us about your own sort of skin regime, your own healthy regime. When you wake up in the morning, it's early there now in the US, but give us your daily sort of, I call it your sort of biohacks, or your strategy, or your schedule in terms of maintaining skin health and general health.
So yeah, great question. So I initially got involved I built out Sunny. It's my own company. I was inspired as a young woman in my teens. I was a ocean lifeguard, beach lifeguard, and I was sitting on the beach for hours. And when you're 18, 19, you don't really care about your skin. What's interesting is that that's changing for the younger generation. They absolutely care about their skin. And if you look at certain parts of the world, like Australia, obviously the UV, the ozone layer, they have to be much more cognizant about their skin. And the earlier you invest in your skin and treat your skin well, the better the results are going to be in terms of your risk for skin cancer and overall skin damage. And I like to remind people that the skin is the largest organ of our body. And so we should be treating our skin very much the same way we treat our gut, the the way we treat our brain. You know, we prioritize sleep, we prioritize healthy eating habits. You should be putting healthy products on your skin. And so that was the impetus behind starting Sunny. In terms of what Sunny does is it's a medical grade skincare line. And so what that means is that a physician has to create the line. You can't have Kim Kardashian coming out with medical grade skincare unless she's partnering with a physician. What's so great about these products is that they are able to penetrate the skin deeper than, let's say, anything over the counter at your local drugstore. And our products are formulated to be cruelty-free, paraben-free, sulfate-free, clean skincare products. So rule of thumb is SPF every day. I have an SPF 40 moisturizer. I'll mix that with my daily moisturizer after I cleanse my face. So when I wake up, I'm going to cleanse my face with some warm water. We have a really nice cleanser that also acts as a toner to balance the pH of your skin. And then once you do that, I recommend, that's when the skin is it's dewy, it's moist, the pores are open. So that's when the products are really going to work if you put them on immediately when your skin is still a little bit moist, a little bit dewy. So I'll start with my moisturizer during the day. I'll start with my moisturizer mixed with my SPF. And then I'm usually right on to makeup. I say makeup alone as an SPF. If you have a concealer that has an SPF 30 or 40, that's not enough. Those products often wear off during the day. So it's good to have that foundation of SPF on first, and then it's a bonus if your makeup has additional SPF. If you're going to be in the sun for long periods of time, you need to reapply the SPF. And I also sell a lip product that has SPF because we oftentimes forget to put SPF on our lips, and our lips are part of our skin and they are able to be burned. So that's sort of my morning routine. And then in the evening, I'll usually take a shower, and that's when I'm applying my serums, my stronger products, because those can sit on overnight. So a retinol once a week, my vitamin C serum, that is basically our SPF at night. It's our daily vitamin. It's going to counteract all of the effects of the sunlight and the UV rays during the day. And then I'll usually put on, in the wintertime, it's cold here, so I'll do a ceramide-based cream, something thick and moisturizing. During the summer, I might just put on a hyaluronic acid just to basically glaze over all of those powerful products and then off to bed.
Brilliant. So that's your skincare health regime, and then we'll go a little bit detailed into a bit of functional medicine. But what else does Dr. Alexis do for her health? Are you into fasting? Are you doing, infrared saunas? Do you do cold plunges? Or, what is your sort of daily, schedule look like?
Good. I wish I had more time for all of that. It seems like it's really beneficial. My sister and my husband do it. I do intermittent fasting. I will usually stop eating around 7, 8 o'clock at night. And then I usually will start eating around noon, 1 o'clock. I try and eat as little carbohydrate as I can during the day. I realize that once I have, a bite of that bread in a sandwich or, a slice of pizza or a bagel, I'm toast, for lack of a better word, for the rest of the day. So try and eating, I have a banana in my bag now. I'll start that around noon. Butters, like peanut butters, almond butters, that sort of thing, nut butters, nuts, vegetables and fruits during the day, avocado, that sort of thing. And then at night, I'll throw in some chicken or beef, or bison meat, which is a nice lean meat, turkey. And then I do have some dark chocolate. It's got antioxidants. Yeah. I'll try and reserve wine and chocolate for the weekends. That to me is a treat. In terms of the plunging, absolutely there are benefits to it. Infrared, yes, there are benefits in terms of, I think if you're consistent with any of these routines, just any way that you're sort of shocking your skin, whether it's with an infrared light or a cold plunge or even a steam or sauna, just allowing those cells to get energized can be beneficial because that'll stimulate your circulation and stimulate the collagen and elastin production.
Brilliant. What about skin health in terms of using these products? Have you seen a big change with people, that have got sort of a detox from the infrared sauna? I'm in my sauna 6 days a week. My community knows that. And in terms of skin health, is there anything specific with regards to people can do to really improve their health?
It's a good question. I'd say consistency is key here. So it's not that any of these things are necessary, they're by no means bad for you. And I think that there are absolutely health benefits. It's really hard to quantify the benefits of one particular therapy because someone like yourself, you're doing a lot of different beneficial things. So to say just that infrared is the magic, golden ticket here, I think it's a combination of all of these, healthy lifestyle choices over a consistent period of time. So one alone, if you're just going to do one cold plunge, is that going to be beneficial? Sure, it might be beneficial at that particular period of time. But if you're plunging every day for 30 days, I think your body is absolutely going to have a change, on a more drastic, on a cellular scale, versus a one-time trying it. But you have to also like what you do, or else it becomes a painful process and you become stressed and your cortisol levels go up. So it has to fit with your lifestyle. It has to fit with what you enjoy doing. So finding these little routines to weave into your day that you look forward to and you have a healthy attitude towards is really the most important, I would say.
Brilliant. But I mean, as a doctor, have you seen it improve people's skin quality?
Well, like I said, these are also the same people who are eating organically and and taking care of their skin. So absolutely, these are the way that infrared works is it's stimulating your cells. That infrared light is targeting the deeper cellular layer and stimulating your cells to boost your circulation, improve your collagen and elasticity. So it absolutely will work as long as you're consistent with it. And the same thing is happening if you're going to have like a microneedling treatment, for instance, or a laser treatment. Like I do a CO2 resurfacing treatment for patients in my office. We're stimulating collagen and elastin, cell turnover, increasing nutrition and blood flow to the skin. These things are absolutely going to have an impact.
Brilliant. Let's talk about your daughters and my daughter possibly. What are you teaching from a gynecological point of view? They're going to start having probably their first period, hopefully at about 12. I don't know if that's got younger because of all these, estrogens. I don't know what the data says there. But, in terms of, using the contraceptive pill and putting, hormones into the body, just take people on a bit of a roadmap, how and what they should be doing with their young daughters.
Again, a very loaded political topic. This is how I handle it in my family. And, you can agree or disagree. We are an almond milk family and an oat milk family, more so almond milk. I try and stay away from dairy. My kids do have yogurt. It's organic yogurt. But I try and limit the amount of hormones that they're consuming. And again, in the products that they use in their shampoo and conditioner, safe skin products that don't have parabens and sulfates and are not endocrine disruptors. So I try and stop it from the get-go, where I'm not serving my children dairy milk and they are not having products on their body that have parabens or sulfates. And again, I understand that a lot of people, you may live on a dairy farm and that may be your main source of protein and nutrition and vitamin D. And so you have to do what works for your lifestyle. In terms of, moving forward, we are very body conscious in my family. We talk about, I think it's important to talk about your bodies. We call, our genitalia their proper names. They feel very open and free to ask questions about their bodies, and as well as my body and my husband's body. I don't want them to be afraid. I don't want them to feel hesitant to talk to me about that. I want them to feel empowered and understand what's happening. And if something's happening to my body and they ask questions, pregnancy, breastfeeding, all of that, I'm very open and candid with them about their bodies and their health, because I want them to feel empowered as they get older. And then, in this country, we're seeing women, young girls, 9, 10 years old, getting their period. And then in the late teens, early to mid and even late teens, on contraception. And don't get me wrong, there are reasons that women should be on contraception if they are, prone to acne, or they have PCOS, which is polycystic ovarian syndrome. I mean, these could be debilitating for young girls. And so there are reasons to be on contraception. It may be a lifestyle choice. Again, every family is different. But I think just having open, candid discussions and using Google in an educational way, to understand, well, if I put my daughter on this contraception, what is What are these reputable websites saying about this? What does WebMD say about this? What does Healthline say about this? What does the GYN or the primary care, the pediatricians say about this, to get good, accurate information about the decision that you're making, as opposed to, talking to your friends on Facebook or reading someone's blog who is not a medical professional. So seek out information that's coming from a medical professional or a reliable medical source.
And is there data now saying that people that take any of these sort of contraceptive pills, that they'll end up with more chances of breast cancers or cervical cancers? It just seems that, cancer is, I think it's almost at the same level as cardiovascular disease in terms of deaths in the US. I think, heart disease and cardiovascular disease is still number one, but cancer is very, very close. It seems like we're losing the battle, against cancer. What does the data and the science say with, all these HRTs and contraceptive pills that these young girls are taking?
So I could not rattle that data off to you because I'm not an OBGYN. And I'm not a breast surgeon. I don't treat the cancers oncologically. I do more of a reconstruction. But yes, if you look at what's happened in the last 20 to 30 years, the numbers are certainly up. And I think that we're learning a lot about the genetic predispositions. We're also identifying women who are high risk at earlier ages. A company like 23andMe, which allows you to basically map your DNA and let you know, you may have a BRCA mutation, you may have a mutation that puts you at a higher risk for a disease. We're seeing this a lot earlier than testing on the back end, so to speak. So a lot of women are having more preventative surgeries, sort of the previvors, as we call them, where they're taking the matters into their own hands and having these risk-reducing procedures to reduce the risk of cancer, because we know, genetically speaking, that they are at an increased risk. And we haven't mapped every genetic abnormality. So there are what are called VUSs, or variants of unknown significance, which may pop up on someone's DNA analysis, where we know that there's something going on, but we don't know exactly what's going on. And so we're tracking these women. I think we've also become much more aggressive in terms of, recommending mammograms earlier, recommending pap smears earlier. If the imaging doesn't look perfect, maybe we're doing an ultrasound or an MRI. So we're catching things at a lot earlier stages. But yes, there are more people on the planet. And so we're seeing higher numbers, but the actual, research data, I would defer to a GYN or a breast oncologist, because off the top of my head, I can't speak, honestly about that.
Cool. Well, I really love the way you've combined, this anti-aging clinic you've got, and Sunny, and, really making the products as healthy as can be without sort of any of these, things that people are unaware of. I mean, people just buy things off the shelves. They're unaware of parabens and sulfates and, possibly aluminum that can cause significant issues. So I think it is correct use of Western medicine. And I think, once again, we can't ostracize Western medicine. There's brilliance to that, how brilliant it is, but we do need to incorporate, as naturally organic products as we can. And it's the combination of two. So the question I've got for you as a plastic surgeon, you've obviously got a unique strategy or plan or process to deal with patients. Tell us, why Dr. Alexis is so unique in terms of, her surgeries or her procedures, and sort of what is your uniqueness that you add to this field?
I think one of my superpowers, so to speak, is that I'm a very approachable woman. I'm 37. I have a 4- and 6-year-old, and so I get it. Like, I'm aging alongside my patients, and I'm very candid about procedures I've had done. I had a tummy tuck last year, which I found to be game-changing for me. I was always very self-conscious about that area of my body. After my 2 pregnancies, I still had a little bit of, moderate amount of abdominal laxity and a separation between my abdominal core muscles, my rectus muscles. And I was empowering all these women to make this change. And I sort of turned the mirror to myself and said, well, you're empowering other women. This part of the body is always, a bit of a pain point for you. So thankfully, my girlfriend that I trained with did my abdominoplasty, and it was just a game changer for me. And it was also interesting because I went through in plastic surgery, we call it the roller coaster of emotions, but I went through the roller coaster of emotions as a patient. So I had that self-doubt. I had this nervousness, this idea of, gosh, you're doing something for yourself when you have 2 young children. Like, who do you think you are? Like, the priority is your family, and you shouldn't take care of yourself. And then afterwards, the recovery, the what have I done? And so I think that helps to make me a much more compassionate and empathetic doctor, because I've lived through it. And so it's interesting. I've even tweaked some of my pre and post-operative protocols, having lived through it, saying, maybe we should do things this way, because I found that this worked for me, and having a more open, candid conversation with my patients. So yeah, I'd say that patients really relate when you're open and honest about the Botox treatment you've had, or the injectable filler, or the laser resurfacing, or the surgery, just to say, I'm in the fight with you. I care about my skin. I care about my overall health. I feel so much better having had this procedure, because it was a functional surgery. So now my workouts are so much more effective. I just feel more comfortable in clothing, and I'm much more body positive. And so I anything that a woman's going through, whether it's a breast reduction or a lift or liposuction, and it's just a little target area or concern that they have, I've lived through it. So I understand what they're talking about.
Great. Do you do any functional medicine, looking at HSCRPs, looking at fasting, insulin, HbA1cs, to just ensure people that have strategies in place before they do these procedures, so you don't have recurrence in terms of doing these surgeries? Does that form part of your protocol?
Yes. So in terms of what we do preoperatively, I would say it starts the minute they call the office or make an appointment. My front office staff and my nurse are investigative journalists. They have to figure out everything about the patients. We want patients optimized, both from a health perspective as well as a mental perspective. Some patients just aren't cut out for elective surgery, and it's really important to identify that and to educate them as to why right now may not be the right time, because you want to set someone up for meaningful change and a successful outcome. And just because someone comes in and they may not mentally be there, they may be going through, a recent family death, or they might be a former smoker but have recently quit, or they need to lose a certain amount of weight. We want our patients to really feel good about this experience. And so on the preoperative side, yes, we look at certain lab levels. I want to understand what they do in terms of their mental health. We've got extensive questionnaires, and I talk to them about, what sort of, are you meditating? Are you participating in physical activity? Do you see a therapist? What do you talk about with your therapist? What issues are you working through, to make sure that they're mentally fit for a procedure? And also, we want to make sure that they're optimized, especially my breast cancer patients. I want them on certain types of supplements, because when a mastectomy is done, the breast surgeon is removing that breast gland. And so the skin loses its nutritional supply, its main source of nutrition, that breast skin. And so it's really important that these patients are on, high protein diets, and they are really taking care to have those green juices and smoothies and supplements as needed for that skin to heal, because now it's relying on the nearby skin for circulation. So absolutely, we do a very intense workup beforehand, and then we're holding their hands afterwards, making sure that, I say between that 2 to 4 week mark, that's when patients feel great and they want to screw things up, and we're calling them, telling them, no, you may not get on your spin bike. You may not, jump in the pool. Like, you're not allowed to do those sorts of things yet until your wounds are fully healed.
Brilliant. At Nature's Thrive, we really believe in the use of health coaches to journey with people, and there's a chasm often between the doctor that's so busy and the rate that the doctor charges, which is fine through the studies and running a practice. But health coaches seem to have a role. They're growing in number both in the US and abroad. What is your role of using health coaches to walk with patients, to guide them along, to support them? Or do you have community groups for these patients so that they can plug into a group of people to help them in their journey?
Yes, I think that's a really interesting point. And that's something we don't formally have a health coach on our staff, but we've taken bits and pieces of that philosophy with us. So oftentimes I'll see with my breast cancer patient that it's after that second surgery, that when their implants are in place, or they've had their sort of final reconstruction, that the mental piece of having breast cancer seems to surface. And so I have a whole slew of partners that we work with, from therapists to psychologists and different sorts of coaches to try and hone in and understand how we can help them. And the same thing with patients who may need to lose a little bit of weight for a certain procedure so that they're lower risk from an anesthesia perspective. I have dietitians, I have specific health food counselors that we refer patients to who communicate with us because it is very much, especially in our field, a multidisciplinary approach. And we want to make sure that the patient feels in the practice that they're very well cared for and that no stone has been left unturned. Absolutely.
If people in Africa are considering any of these procedures, what should they look out for in terms of their doctor? There's this whole, and I don't want to press you. I understand that, you have your own view on, breast implants. There seems to be a whole, community out there in the world. But,
I frequently talk about that. So I would say if you are ever considering a plastic surgery procedure, you have to do your homework on the front end. So for example, in the United States, there are plastic surgeons and there are cosmetic surgeons. And there's a major difference between the two. So plastic surgeons, if you're board certified by the American Board of Plastic Surgery in this country, it means that you have to do rigorous training. You have to sit for multiple exams. It took me 11 years of training after college to become a plastic surgeon. And then I had to pass a written exam, and then I had to pass an oral exam. So all in probably 13 years from start to finish. And so whatever country you're in, you want to make sure that you're seeing a certified surgeon by that country. Cosmetic surgeons, anyone in our country can become a cosmetic surgeon. It could be a gynecologist, it could be an anesthesiologist, it could be a medical doctor. The regulations on that are very loose. And so it's not that same type of rigorous training, and they just don't get the same exposure. They're not in the operating room for 7 years, that sort of thing. So in America, I always say I'm a board certified plastic surgeon. In your particular country, I would look for that same sort of certification. You want to read real patient reviews. When you go into the practice, you want to ask to see their before and after gallery. In our practice, I've encrypted it for password protection for our patients, just because I don't want creeps looking at our befores and afters. So I feel like, these women have been generous to share photos of their body, and we need patients to request access. A lot of people have open galleries, but you want to really look at befores and afters to make sure you find a photo of someone who resembles your body. If you are, a size 8, you want to see women who are size 8s who have the same size breasts as you and what a reduction would look like. You should also request to talk to a recent patient of the practice who's gone through the experience, because oftentimes I find that really helps patients understand talking to a patient who's recently been through a breast reduction or a breast lift or a tummy tuck. It's very well within your right to ask for all of these things. And if your surgeon shies away from it, it's not necessarily a red flag, but it should give you some pause because you're spending time, money, and energy, and you want to feel really confident in your decision. And I also recommend you get multiple consultations. So spend the time seeing 2 or 3 doctors to understand who really fits with what you're looking for and who you feel most comfortable with. So that's sort of the homework piece of it. And what was the second question? Oh, the breast implants.
Yeah, just the breast implants. As a physician in my other life, many patients come in and have sort of these out-of-body experiences, don't feel the same, affects their lymphatic systems, and they got psychological sort of impact. What is your view on that?
So in our practice, I treat women who want to have implants placed, whether it's for cosmetic or reconstructive reasons. And I also treat women who feel their implants are making them sick. They identify as having breast implant illness. In our country, that's not an official medical diagnosis yet. I believe at some point it probably will be. And it's really interesting to understand the history of breast implants. In our country, they came on the market in the 1970s. When they first came on the market, there was no FDA. So in our country, the Food and Drug Administration has a Medical Devices Act, and that allows our patients to, or our physicians and the FDA will perform studies on any medical device to determine its safety before putting it on the market. But in the 1970s, there was no FDA Medical Devices Act. So implants just came on the market. And the first generation of implants was a very thin shell and a very gooey silicone gel. And there were very high rates of rupture. And so women were very concerned that their implants were making them sick. So this isn't a new topic. This has been going on for, at this point, 40, 50 years. What we saw in the 1980s was that there were a lot of class action lawsuits against implant manufacturers. They took silicone gel off the market and they studied the safety of implants from 1992 to 2006, specifically silicone gel. In the United States, there are no silicone-free devices. So even saline implants have silicone shells. The saline was allowed to be on the market while the trial for the silicone was going on from 1992 to 2006. 2006, the FDA released that they found no association between autoimmune diseases, connective tissue diseases, any sort of health conditions, and they put silicone gel back on the market. And then what we're seeing in 2007, 2010 through 2012 is the advent of social media, Facebook, Instagram, and a lot of women are coming together and saying, wait a second, I think my implants are making me sick. And so the symptoms are very general, anything from GI disturbance to muscle fatigue, brain fog. And just as a comparison, there's about 35 million women who have breast implants. These groups have about 100,000, 150,000. So it's a significant number, but it's still small as compared to the amount of women who still have implants in their body. And so we are now, especially as a society in the United States, the American Society of Plastic Surgeons, the American Society of Aesthetic Plastic Surgery, the FDA, we're all working together to try and understand what's going on. This may not be as easy as it being an autoimmune disease. This might be a toxicity disease. This might be, there are some heavy metals, and so we're studying those. And so I say to my patients who come in who feel like their implants are making them sick, well, step one is you need a full medical workup. So we found Lyme's disease in patients. We found adrenal insufficiency in patients or thyroid issues. So let's make sure that your body is otherwise functioning properly before we go in and do an elective surgery to remove your implants. And once we're at that stage where patients have been optimized, I will take the implants out and I'll take all the scar tissue around the capsule. The traditional term is a total capsulectomy. Other women refer to it as an en bloc capsulectomy. There's a whole debate about what the difference is there. I will take all of the capsule out, and I don't promise women that they will get better because we don't have the data to support that. What I usually say to patients is a lot of women do get better. It could take months or years. And what I have found in our practice is that a lot of women do get better and we don't understand why they're getting better. So it remains to be seen. And right now we're being told again that these devices are safe devices. We only use smooth devices in our practice. I don't use textured devices for reasons which we can get into if you'd like to, but with breast implant lymphoma, those have been associated with the textured devices. So I do use smooth devices in this practice. And I say to them, it's the equivalent of going to a car dealership and purchasing a car. We're being told all of these parts are currently on warranty. If for some reason the warranty changes, it's my obligation and our practice will reach out to you and discuss what the options are based on what the FDA and the medical manufacturers, the implant manufacturers deem, safe and responsible and appropriate to do. And the majority of my patients in my practice understand that. And a lot of them will elect to have implants taken out, and I'll take all the scar tissue out, and then we'll just watch and observe and see how they feel. So that's sort of the gist on implants.
Great. I think that's a great summary and well said. But if I have to just press you, and I know you're a plastic surgeon, but at the end of the day, do you not think there's a risk with these implants? I mean, yes, the other procedures, I don't think you're going to get these type of, side effects from doing a tummy tuck or, doing sort of cosmetic surgery. I mean, at the end of the day, to put something like that in, would you suggest it for the average person? I mean, obviously some people, have been traumatized with, mastectomies and breast cancers and that, and it's important to them. So we do want to meet people where they're at, but is it not something that is sort of highly not advised with regards to the possible side effects in the long term?
So I think this is really where science kicks in, and it's really important to see what the numbers show. And there are certainly, I can't tell you, I have a patient that'll come in and implants will be a game changer for her in terms of her self-confidence. She's over 18, she's over, usually patients in my practice are in their early 20s to 30s. And they're educated on the risks of the fact that these are not perfect devices. It's the same. My husband's an orthopedic surgeon. It's the same thing with hip implants. Anytime you're putting a foreign object into your body, whether it's a pacemaker or a breast implant or a hip implant, your body responds to it by making scar around it, identifying it as foreign. In the breast, that's called the breast capsule. And it's not accepting it. It's dealing with it. And I say to patients, you have to know, you have to listen to your body and see how it feels. And if it doesn't feel right, then we need to monitor that. And if we need to take it out, we take it out. But to say to someone who has breast cancer, you can only use your own tissue. A lot of women are petite and they don't have tissue for a free tissue transplant, or they're not a candidate for a 10 or 12-hour operation, or they just don't want to have more scars on their body. Or I'll have young women who have congenital breast anomalies, where one breast is really large and the other breast is non-developed. And so really the only way you can treat that is with an implant. So I think it really depends on the situation, and I treat every patient uniquely in regards to what their situation is. And we do at the same time, we're evaluating them to make sure they're safe and sound to make this decision to put this device in their body. We have them sign numerous consent forms. We're monitoring them. So I don't think it's so black and white. I really feel like it is gray, because I'll have women who come up to me and will hug me and say that this was a game changer for them, that this changed their life, and thank me. And to say that that's not valuable, with them fully understanding the risks. We've got a vaping problem in this country. We've got, people make decisions all the live long day, knowing risks and benefits. And do I think that implants are dangerous? Listen, they're not part of our body. And I say to implant manufacturers, it's been 50 years. Why can't we come up with something that is not, made of silicone? Like, why can't we, look into that? And I'm being told that is being investigated. Not to say that what they come up with may or may not have its slew of issues, but when you look at all the other industries, like I know in joint replacement surgery, there have been recalls on those devices. These are not perfect devices. The body did not make these devices. And so you have to know yourself and your body. And same thing with IUDs with women. Some women tolerate them, some women don't tolerate them. You have to figure out what works for yourself. And so for some women, it's a game changer, and some women, it just isn't right for them.
Got you. And I think that's well said. I do think we do need pioneers like Dr. Alexis to start asking those questions of manufacturers, of saying, surely we can find something from a bodily tissue point of view that might have far less side effects. And I think we do need sort of those courageous, callers like yourself who say, I'm going to have a sunny range that is going to be parabens free, sulfates free, aluminum free, because actually these, substances are not part of, our history and our culture. And I think they can have significant detrimental effects. We're coming to the end of the show, Dr. Alexis. I want you to give a message of hope to women across the board. In many aspects, I'm very disillusioned with, health and disease, how it's growing. I've had some incredible guests on the show, having a look even and I know a lot of the American stats, but 25% of the American population, that's about 80 million people, have an autoimmune disease, almost a combination of, your heart disease, cancers, and your neurodegenerative conditions combined. So it seems like we're just becoming a sick nation. What message of hope do you have that we can leave with the viewers and the listeners?
I would say that you need to advocate for yourself and your family and your friends. And the best thing that you can do is become an educated consumer. Before you click that buy button, just take an extra minute to make sure that what you're purchasing is healthy for yourself and for your family. And I think, the power of spending dictates where research and development goes. And so you have that power. It can be a daunting task, but just hang in there, and you are making a difference. And your health should be a priority in your life. I remember being a young mom, and my mother would say to me, if you're not healthy, you cannot take care of your children. And so, whether you need to take that extra 20 minutes for yourself to do some meditation or yoga, or, your skincare routine after you get out of the shower, whatever you can do to better your health will be for the betterment of society.
Brilliant. And the very last question, what are you excited about in terms of the biotech space or the healthcare space that, in 5 years' time, we're going to be saying, my goodness, this is incredible. This has been a game changer for people's health, and especially in the women's health, sort of arena.
I think for us, we're going to have more clean options on the market, more, people care about the environment, and that's being shown. And I'm hopeful that we have more environmentally friendly products. I think product packaging is changing, less plastic. We had styrofoam growing up, and there's been bans on that in plastic bags in our cities and states. And I don't want my children to remember styrofoam. I don't want them to remember plastic. So I'm excited about that change. And I think we're just, from the plastic surgery space, much more innovative products and much more innovative procedures that keep people out of the operating room looking great and feeling great with little downtime. So all of those things, I'm really looking forward to seeing changes there.
Brilliant. Well, I declare favor and blessing over you, that you would thrive, that you would live out your calling and your purpose, and that you would transform many people's lives as you sort of navigate this crazy, chaotic world. And just thank you for your time, and just thank you for who you are, and love to see your daughters grow up into these healthy, women, being bold, strong, and smart as Girls Inc. Just love the website, just love the people that you're supporting, and just your social upliftment. It is about business and, creating, the environment we want to at work, but it's also about socially supporting other people, and empowering others. So thank you so much.
Thanks so much for having me. What a great platform. And I appreciate all the work that you do as well. It's fantastic.